Hi, I'm Jane, an Alto Pharmacist specializing in fertility. I'm here to walk through injecting your fertility medications. We'll go through several steps together, so stay tuned. Always make sure your hands are washed and you're working on a clean, flat surface. Let's begin. For this injection, you will need 1 vial of diluent and at least 1 vial of 75 IU Menopur powder, depending on your dose. For example, if your dose is 75 IU, you will need 1 vial of powder. If your dose is 150 IU, you will need 2 vials of the powder. If your dose is 225 IU, you will need 3 vials of the powder, and so forth. You will also need a 3 milliliter syringe, a 1.5-inch needle for mixing, an injection needle, a few alcohol swabs, a sharps container, and sterile gauze or tissue is optional. Before we get started, there are a couple of things I wanted to review with you. Examine your medication. Make sure the medication is not expired. Check to ensure there are no cracks on the vials and there is powder or a pellet in your powdered vial. Sometimes the Menopur powder can adhere to the side of the vial. If that happens, gently tap the vial on a hard surface so the powder falls to the bottom of the vial. Also, make sure the diluent is clear and does not contain any floating particles. If you see anything, call your provider or an Alto pharmacist for next steps. Alright, let's get started. Pull off the plastic cap on the Menopur powder vial and vial of diluent and wipe the tops with an alcohol pad. Unwrap your needle and syringe and twist the mixing needle onto the syringe and remove the cap. Pull back the plunger to draw air into the syringe. Fill the syringe with roughly the same amount of air as the amount of diluent you were instructed to mix with. Place the vial of diluent on a flat surface and insert the needle straight through the center of the rubber stopper. Slowly press on the plunger to push the air in the syringe into the vial of diluent. Pushing the air into the vial makes it easier to withdraw the liquid because the vials are pressurized. Invert the vial and pull back the plunger to withdraw the amount of diluent you were prescribed. For Menopur, it is typically 1 milliliter or 1 cc. Whenever you're pulling liquid out of the vial, make sure the tip of the needle remains submerged in the liquid. You can do this by slowly backing the needle out of the vial as you withdraw the solution. This will ensure you're drawing up the liquid and not the air inside of the vial. Flip the vial back and remove the syringe from the vial. You can discard the used vial of diluent into the sharps container. Place the Menopur powder vial on a flat surface and insert the needle straight through the center of the rubber stopper. Slowly inject the diluent into the powder. Menopur powder usually dissolves instantaneously, but you can still swirl the vial to make sure it's thoroughly mixed. Do not shake the vial. Without removing the needle, invert the vial and pull back the plunger to withdraw the entire content of the vial into the syringe. Remember to keep the tip of the needle submerged in the liquid. This may mean you have to pull back the needle a bit to make sure the tip remains in the liquid. If you're mixing more than 75 IU of Menopur, repeat this process using the mixture in the syringe to mix your subsequent vials of Menopur powder. For example, if your dose is 150 IU, you will use the mixture in the syringe to mix another vial of Menopur powder. If your dose is 225 IU, you will use the mixture in the syringe to mix 2 additional vials of Menopur powder, and so forth. The safest way to recap your needle is to lay the cap on your table and scoop up the cap with your needle like so. This will reduce the chances of a needle stick. Now, attach the shorter injection needle to the syringe and pull off the cap. To remove any air bubbles, tap on the side of the syringe so the bubble moves to the top. Gently push on the plunger until you see a tiny droplet come out of the tip of the needle. Once you see the droplet, you are ready for your subcutaneous injection. Today, I'll be showing you how to inject in the abdomen because it's the most common location for subcutaneous injection. However, you should check with your doctor or nurse before injecting to ensure you're injecting at the prescribed location. You should inject at or below the level of the belly button, roughly 1 to 2 inches away from the navel. Try not to inject directly below the navel because that area is very vascular and can lead to bleeding and bruising. You should also rotate your injection sites to decrease discomfort. To prepare for your injection, clean the injection site with an alcohol pad and allow the area to air dry. Gently grasp a 2-inch fold of skin between your thumb and index finger at the injection site with your non-dominant hand. Hold the syringe in your dominant hand like a dart and insert the entire length of the needle into the pinched skin at a 90-degree angle. You can insert the needle at a 45-degree angle if you have less fat on your body. Move your index finger over to push down on the plunger in a slow and steady motion until all of the medication is injected. When you're done, release the pinched skin, hold it for a few seconds, and gently withdraw the needle. Lastly, apply light pressure to the injection site with gauze or tissue if there's any discharge. Discard the used needle and syringe into the sharps container. There may be minor bleeding, bruising, or redness around the injection site. You might also see a drop of liquid come out of the injection site after you pull the needle out. All of this is common and should not be of any concern. Let's talk about storage. Menopur is a medication that can be stored at room temperature or in the refrigerator until the expiration date. Once it has been mixed, it must be used immediately, and any unused portion of the medication should be discarded. Menopur should also be protected from light, so store it either in the original packaging or the amber prescription vials it came in until you're ready to prepare for administration. You're done. Thank you so much for watching. If you have any questions, visit alto.com to get in touch with an Alto pharmacist.